We stay at home because the Gambia has so far served 38 days in the extended state of public emergency by the National Assembly in Banjul. This adjustment followed the expiration of a 21-day of partial lockdown declared by President Adama Barrow under the powers vested in him by the 1997 Constitution. However, with the country counting more than 20 cases of the COVID-19 since March, the government is very likely to go in for a longer state of public emergency. Let's have more details of that in this report.
The Gambia is in the verge of further extension of the state of public emergency, which is due to elapse next week Tuesday. In April, the National Assembly extended the initial 21-day state of public emergency for additional 45 days that ushered some restrictions in the field of transport and commerce. The regulations closed all non-essential food outlets, schools, and places of worship across the country. The public had since complained of being locked indoors without optional means of living. The Vice President and Chairperson of the COVID-19 Ministerial Committee told iAfrica on Friday that the government will continue to rely on experts from the health sector to determine the need for another extension of the partial lockdown.
Well, we are watching the situation because COVID is a pandemic, and you have seen the surge emerging as at now. Different countries are at different levels. So as it comes, then the decisions that His Excellency will take will depend on the technical guidance and advice from the Ministry of Health and other relevant institutions that will guide that process. So we're waiting to see.
The Gambia government launched food aid worth $700 million in rice, oil, and sugar designated to support 84% of the needy and vulnerable households in the Gambia. As of last week, the greater percentage of the food aid had been dispatched to about 324 distribution points across the country, according to the Vice President, but more people are in the waiting sickness.
When people are hungry, you cannot tell them wash your hands and come and eat. But I would urge them to just be patient, or everything that is moving from one corner of the country to the other is all for them. And 84% of the population is almost like covering the whole population.
Whether what if offered by the government will be enough to motivate extension of lockdown or not, the Ministry of Health had more than enough reasons to stress the need to continue to stay at home. Since the outbreak of the coronavirus in the Gambia in March this year, more than 1,000 tests have been conducted, from which 20 have been confirmed positive of the virus.
Looking at the projections we had, at this time should have been the peak. From now till around the 17th, we should have been having, without no social distancing, about 3,300 cases. And if we are having, so I think the measures the government has taken has helped a lot. And I think we should ensure that we should not rest on our laurels, because we are surrounded, for example, by neighbors that are having a lot of cases, and we cannot rest until the fire around you is calm before you can stop. So I think our intervention should be the same, or even strengthened further. That would be our advice, I think, to the National Assembly going forward.
During the first month, 8 out of the 10 cases were imported mainly from Europe, but the trend has changed in April and May, showing 7 out of the 10 cases under treatment as a result of local transmission of the COVID-19. The Africa Center for Disease Control and Prevention disclosed over the weekend that coronavirus cases are accelerating at an alarming rate as a number of African countries began to soften grip on restrictions due to the economic pressure. The number of confirmed COVID-19 positive cases across Africa had reached nearly 60,000 cases, the Africa Center for Disease Control and Prevention disclosed over the weekend. Reporting for iAfrica News, I am Absegay.